here for privacy. I am Katie and I'm going to be your nurse today. I'm going to be performing a head-to-toe assessment so that we can establish a core baseline so that we can better coordinate your care. I'm going to start by performing hand hygiene. Okay. Will you go ahead and tell me your name and date of birth? Patient has identified himself as Mr. Johnson and date of birth, also verified using armband. I'm going to start by raising the head of bed, 45 degrees angle, and raising the bed to an appropriate level for me to perform my assessment. Mr. Johnson, do you know what month you're in? Patient identified the month as September. Do you know where you are? Patient identified that he's in the hospital. Do you know why you're here? Patient also stated that he's here for pneumonia. Do you know what year we're in? Patient states 2024. Do you know what president? Patient states Joe Biden. Patient is alert and oriented ×4. I am going to start by doing the head. So I'm checking for any bumps or bruises, any pressure injuries. I'm also checking for infestations. I'm also checking for hair distribution. None noted. I'm looking at the general appearance of the patient. Patient is appropriately dressed for the weather. Patient does not display anything that is out of the ordinary. Patient's behavior appears to be according to, it does not appear abnormal. Patient does not have an odor, and patient's environment looks comfortable. I'm going to move on to the face. So I'm going to be checking the face for any wounds, any bumps, any bruises, any edema, none noted. I'm going to have patient raise eyebrows, close your eyes tight, open eyes wide. I'm going to have you smile and frown, cranial nerve intact. I'm going to have patient, just to check eye movement on patient, checking for dilation. And I'm going to have the light focus on one eye while I focus on the other, and the same for the other side. Pupils are reactive and round, and reactive to light, and accommodating. I'm going to move forward with checking the ears. So I'm going to pull the pinna back, and I'm checking for cerumen buildup. I'm also going to cerumen buildup on both ears, checking for drainage, checking for any redness, checking for alignment. Facial features are aligned, eyes are in place, ears are aligned, okay. I'm going to move on to the nose. I'm going to have patient check for obstruction. So I'm going to have patient breathe in while I cover one side, and the same for the other. There's no redness noted, no drainage, no discharge. I'm going to move on to the lips. Lips are dry, no cracks, nothing, no. Checking for tongue, have patient move tongue up and down, side to side. Do you have any broken or loose tooth, any dentures? Patient notes no dentures. Patient does not wear hearing aids. Patient does not wear any dentures, doesn't have any broken or loose tooth. Did you have a cough recently? No cough. Noted, stated by patient. Do you have any issues swallowing? No issues swallowing. I'm going to move on with checking the lymph nodes for any swelling. Patient lymph nodes seem to be intact. I'm also going to be checking the neck for alignment, checking to make sure trachea is aligned. I'm going to be palpating the carotid artery one at a time. I'm going to have patient turn to one side while I check for jugular vein distension, and turn to the other side while I also check for jugular vein distension. None noted. I'm also going to be checking for skin turgor on patient. No tenting noted. I'm going to have Mr. Johnson sit forward, and I'm going to be auscultating the posterior lung sounds. I'm going to have Mr. Johnson breathe in and out as I am, each time I put the stethoscope on, checking for all areas here. checking the spine for any abnormalities. I'm also checking the skin for any skin breakdown, rashes. Skin is warm and dry to touch. I'm going to move forward with anterior lung sounds and have patient breathe in and out each time that I touch with the stethoscope. No crackles noted, no diminished breath sounds noted. Bilateral lung sounds are strong, +2. I'm going to move forward with checking for heart tones. Start with aortic, pulmonic, Erb's point, tricuspid. And I'm going to listen to the apical sound for a full minute. Now, as I am moving on to the thoracic area, I am also looking for any skin breakdown. Skin is warm and dry to touch. There's no bruising noted, no edema noted, no rashes, bumps, bruises, warts, no skin breakdown noted. If this was a female, I would also be checking for any lumps in breast area or any tumors. I'm going to move forward with checking the arms, and I'm going to be checking for skin breakdown. I'm going to be checking for strength in the arms bilaterally. Bilateral strength. I'm going to have patient grip my hand. Check for patient grip. Bilateral strength and grip. I'm also going to be checking for capillary refills on all fingers. Capillary refill less than 3 seconds. Checking elbows and bony prominences for any skin breakdown, none noted. Patient is dressed appropriately for the weather. Patient's color is according to ethnicity. Patient environment is comfortable. I'm going to put the patient in from the 45-degree angle to a supine position, as I'm going to be checking for the abdomen. Had I had a sheet, patient will be covered for appropriateness. I'm going to be listening to the abdomen sounds. So I'm going to be auscultating from the lower right quadrant to upper right quadrant, upper left and lower left quadrant. I'm also going to do the same direction for palpating, starting with the lower right quadrant, the upper right quadrant, upper left quadrant, lower left quadrant. Mr. Johnson, have you had any issues going to the bathroom or any issues urinating? Is there any color, any smell that's noted? Is there anything that's out of the ordinary that's noted? Patient stated everything is fine, nothing out of the ordinary that's noted. Patient's abdomen is warm and dry to touch, it's not distended. Patient's skin is intact, no skin breakdown noted. No wounds or warts or bruising. I'm going to cover patient for privacy, and I'm going to move forward to extremities. I'm going to start by checking for any edema, any varicosity, any breakdown of skin, checking for any signs of bumps or bruises, which could indicate pressure injuries or blood clots. I'm going to be palpating popliteal pulse. I'm also going to be palpating the dorsalis pedal pulse. I'm also going to be checking for capillary refill less than 3 seconds. Pedal pulse, bilateral and even strength. Also popliteal pulse, bilateral even strength. Skin is warm and dry to touch. There is no abnormalities noted. Do you have any issues walking? Do you use any assistive devices? I'm also going to perform ADLs on patient just to make sure that mobility is intact. Patient states they're independent, goes to the bathroom regularly, no issues moving around on a daily basis. Prior to my assessment as well, included in my assessment as well, is vital signs check. I'm also going to be checking for blood pressure, for temperature, for heart rate, for respirations, and for O2 monitoring. Vitals are intact for patient. Do you have any questions for me? Mr. Johnson, do you have any pain? Patient states no pain. Patient is comfortable. I'm going to raise the head of bed to patient's preference. I am through with my assessment. I am going to be just ensure that bed is locked and in the lowest position that is safe for a patient. Head of bed is raised according to patient's preference. I am going to be lowering the bed, and I'm going to provide the call light in place. All personal items will be close to patient. Environment is checked, and everything is appropriate according to client's safety. I am through with my head to toe assessment. I am going to start by removing my glove and performing hand hygiene.